Hi, my name is Justina, and today I'm going to be talking about sex education. So the teen pregnancy rate and the number of adolescents affected by STDs is amongst the highest in teenagers in the U.S. compared to other developed nations. And this is a result of the effectiveness of certain sexual education programs. So states currently have the power to decide if and what type of sex education is taught in their schools. So the Sexual Information and Education Council of the United States defines sex education as teaching students about sexual development, sexual and reproductive health, and interpersonal relationships. One type of sex education is a comprehensive program in which this council defines as age-appropriate, medically accurate information on topics related to sexuality, including human development, relationships, decision-making, abstinence, contraception, and disease prevention. The other type of program available for sex education is abstinence-only sex education, and it is, as explained in the Social Security Act, it is the teaching of abstinence from sexual activity outside of marriage as the expected standard school age of children for all school-age children, and stresses the social, psychological, and health benefits of abstinence. So abstinence-only programs do not cover the use of contraception, as many people feel that these teachings encourage kids to have sex. However, it's unrealistic to think that teenagers don't have sex and do not need to be taught about protection. Therefore, my major claim is that abstinence-only sex education fails to protect students from sex-related complications. First of all, it doesn't reduce the likelihood of engaging in sex. Second, it doesn't reduce the spread of infection and disease. And third, it doesn't prevent unplanned pregnancy. So first, in a study conducted by University of Washington doctors, shows that abstinence-only education does not reduce the likelihood of engaging in sexual intercourse. So the main goal of abstinence-only programs is to delay sex until marriage. And they do this through programs like virginity pledging, which makes students vow that they won't have, or they will abstain from sex until marriage. However, the study shows that virginity pledges are ineffective in abstinence-only programs because people who have taken the pledge are just as likely to have sex as those who haven't taken the pledge. Also, a study done by Congress also shows that there is no strong evidence that any abstinence program delays the initiation of sex. Secondly, abstinence-only sex education does not reduce the number of sexually transmitted infection and sexually transmitted disease cases. So the Journal of Adolescent Health has an article which shows a study that shows that those who break the virginity pledge are less likely to use contraception after initiating intercourse. And it goes on further to say that those who break the pledges are also less likely to get tested for STIs, just maybe because they don't know about it, or maybe they don't know that they need to get tested because they haven't been taught that, and this therefore increases their risk of obtaining them. Also, abstinence is just not 100% effective in preventing STIs, as many teenagers fail to remain abstinent, and also STIs are also spread through other types of sexual activity like oral sex or kissing. So third, in the University of Washington study, it also shows that adolescents who received comprehensive sex education have a 50% lower risk of teen pregnancy than adolescents who received abstinence-only education. This is just because they don't teach about contraception, so that lack of knowledge shows in this statistic. The University of Georgia also conducted a study that shows that teenagers between the ages of 15 and 19 are more likely to become pregnant in states that have abstinence-only education. So the statistics of well-researched studies show that absence-only sex education does not reduce the likelihood of engaging in sex. It does not reduce the spread of infection and disease, and it does not reduce the number of unplanned pregnancy, and therefore absence-only sex education fails to adequately protect students from sex-related complications. Thank you.
All right, Justina, it takes you almost 2 minutes to get to the proposition. We got a lot of background information, a lot of definitions, but you want to get to the proposition, I think, a little bit sooner in your speech. And since it takes you 2 minutes, that means that you've only got 3 minutes and 25 seconds that you actually develop that particular argument. Everything else before is background and definition. I thought you had a good preview of what the supporting claims are going to be. That makes it relatively easy to follow the argument. I thought that your proof on the first couple of points was a little bit thin. The explanation of the virginity pledge is interesting, but I'm not exactly clear how big a part of the curriculum that is, whether or not that is standard in all of the absence-only programs. It's kind of a vague reference to that, and most of your criticism by comparison to abstinence programs is focused on that particular pledge, and so you need to show that it is intrinsic or inherent in the absence-only programs, that is in fact the policy that they follow. The data on the first 2 points I didn't think was as strong as it needed to be. In fact, on the second point it says abstinence is not 100% effective since people do not remain abstinent. Well, duh. I think that's a little bit problematic. And the argument really is that abstinence is not effective because people don't remain abstinent. So the problem is that it's difficult to teach people to remain abstinent, and that I think was a little bit would be a clearer way of expressing it. Your third point, though, was a little bit clearer, and you actually had some citations on that I thought were a little also clearer. Congress doesn't generally do studies, so I mean there may be a study that was commissioned by Congress, but you should be citing that more specifically. The University of Washington and the University of Georgia studies I thought were much more effective on that last point. I thought you did a very nice job presenting to the audience. Got to shut off here so that we can get our last speaker in for the